Hi guys, my name is Dr. Maleeha Jawaid and I'm a skin specialist. You need to treat them based on their hormonal issues or their dietary imbalances, or if somebody has a very strong genetic tendency for acne, you need to just counsel them well and tell them this is something they probably have to deal with for a lot longer. So there are a few factors which cause acne, which is excessive oily skin. Then you've got a certain kind of bacteria which causes the infection. Then you've got the hot and inflamed part of the skin, and then you've got a couple of other technical problems which go under this. Besides that, scarring is also one of the commonest issues that we see in the clinic. Scarring usually is a sequel of acne, of very severe acne, which hasn't been either managed properly or was not attended to on due time. It falls under the umbrella of pigmentation. It's called melasma, which is usually seen in older women. So you'd probably see somebody who's around like 35 plus, I would say, or even like 40 above. They've got pigmentation around their cheek area, or sometimes their forehead, nose, or even their upper lip area. This is unfortunately again a chronic problem, like most of the other skin problems. You've got different treatment options, and the best advice that I can give to my patients or anybody who's listening out there is sun protection. If you've developed melasma, chances are that you will keep developing it further. So protect yourself from the sun. We can't obviously reverse your entire aging process. We can't stop it either, but we can just make it slower and more beautiful, I would say. So what you can do is you can either start with topical creams, and a lot of people ask what's the right age to start using the creams. So generally I tell people, like, the minute you hit like your mid 20s, or let's say even early 30s for that matter, start incorporating small stuff. Start using retinol based products, which are basically, again, they're the topical version of isotretinoin, vitamin A derivatives. They help in increasing the turnover of your cells. They will prevent your lines from happening. They prevent sun damage, and they just make your skin look nicer, plumper, and fresher. So when somebody's got, let's say, lines on their forehead, or they've got some lines, any expression lines anywhere. So let's say I've got lines here, or I've got lines over here which aren't set yet, but let's say about like another 5-10 years they'll probably get set. I can relax those using Botox. So a Botox session will give you a more relaxed and a refreshed face. Fillers, they just go by their name. They fill up a space. So somebody who's lost volume over here, like I mentioned earlier, you lose volume in your cheeks as you grow older, or you lose volume over here, or somebody loses volume here. You can't reverse it entirely. You will have to wait about 6-9 months till it gets dissolved, or otherwise, let's say if I put a Botox here to turn my smile upwards, if I put too much, I get that Joker smile. It's actually called a Joker smile. I can put some here and kind of just balance it out, right? So you can balance it out. It is it's not the easiest thing to do, to balance it out. Fillers, a good thing about fillers is that you can reverse them. If let's say somebody's filled your under eye area and it's filled too much, like it's swollen now, you can inject the antidote and it will dissolve the filler. One of the biggest complication, and I would say the scariest complication of fillers, is you can fill and occlude an artery. So the most important natural ingredients that I think that can help you are multani mitti, which is effective in really tightening your pores and reducing the oil production. The minute you tighten your pores, the production of oil in any case decreases in your skin, right? So there's multani mitti. If somebody has dry skin, milk and yogurt really works for them. Somebody who's got acne, so haldi, turmeric, that really works for them. It's got anti-inflammatory properties. Honey is anti-inflammatory nature. So people who've got acne, you'll actually see, they'll actually tell you that they put haldi ki paste on their face, which kind of gives them a yellow shade as well, but that washes off. But that really helps in acne. Then you've got brown sugar. So the softer brown sugar, not just sugar granules. The brown sugar can be used as a natural exfoliant. If you don't want to buy something from the market, what I personally tend to do at times is I just take a tablespoon of brown sugar, a bit of honey, literally 2 drops of lemon. I mix that and use it as an exfoliating mask on my face. So it's number 1 cheap, number 2 natural, and number 3 you're not adding any other extra ingredients on your face. Besides that, everything that you apply on your skin, most important is what you eat. So in any case, if you're not eating well, no matter how much skincare you do, no matter how much you spend at Sephora buying all the skincare products, your skin will never look the way you want it to look. So what you eat shows up on your face, shows up in terms of your hair health as well. So eat fresh, eat clean, drink a lot of water, do your yoga, do your exercise, sleep well. Sleep is probably the most underrated aspect of skincare, because you need at least 8 to 10 hours in a day, well at night, for your skin to repair and for your body to just calm down as it is. Take less stress. That's one of the biggest factors which leads to any skin condition, not just acne. Name any skin condition or hair condition, it's triggered by stress.